well, at least you'll need to keep the rain gear fairly close by. Johnny?
All right, Todd, thanks so much. Trident Health is the first hospital in the Low Country to offer low-dose CT lung cancer screenings. Today we welcome Wes Fox along with Dr. John Carmain with more on these screenings and who can benefit with this great new technology. Gentlemen, welcome to the program. Great to have you here.
Great to be here.
Dr. Carmain, I want to start with you a little bit. Tell us about these CT scans and what it is and who is really eligible for them.
Okay. Well, lung cancer screening has been in the news a lot lately because the United States Preventive Service Task Force has endorsed it as a method for lung screening. It's a program designed to detect lung cancer in the early stages and more treatable stages in patients who do not have symptoms, but are at high risk, usually due to a history of smoking. What it involves and the mainstay of the program is low-dose CT scanning. A CT scanner uses X-rays taken at different angles to produce highly detailed images of the lungs, which are then analyzed for nodules or other signs of cancer.
So when exactly do you have to go and get this CT scan? What are the symptoms, I guess, or lack of that you need to go in and see, you know, I might have a problem here, I need to go get checked out?
And well, Trident's really looking to focus the screening on patients that are at high risk for developing lung cancer. These are patients between the ages of 55 and 80 who have a history of heavy smoking.
Yeah.
Specifically a pack of cigarettes a day or more for the last 30 years, even if they've quit recently. But we do encourage patients that feel that they're at risk for developing lung cancer to talk to their primary care doctors about their possible participation in lung cancer screenings, because even if they don't hit that high risk bracket, they can still qualify for lung cancer screenings.
Are you seeing lung cancer rates go up, go down? I know there's been a lot of anti-smoking programs out there the last 10 years. Or how are rates looking right now?
Well, rates haven't changed that significantly recently, but we're hoping that the survival rates change with the implementation of the lung cancer screening. Lung cancer is the leading cause of cancer deaths among both men and women in the United States. The National Lung Screening Trial, which was the main trial which showed the benefits of low-dose CT scanning for screening for lung cancer, demonstrated a 20% improved survival in patients who underwent the low-dose screening versus those who did not. And when you're talking about 150,000 people or more every year who die of lung cancer, that's a lot of people that can be helped.
Absolutely, absolutely. This early detection is the key. Wes, you work with these, you do them probably just about every day. What's the difference between the low dose and the high dose, and what's so great about that finally being here available in the Low Country?
Well, low dose, you're really getting a fraction of the typical radiation that you would get out of a typical chest CT exam. So just that benefit alone is helping with the screenings come along. We're seeing a lot of patients benefiting from this early screening, and so we're very, very happy about that.
Yeah, absolutely. So what age group again should go and try and make that appointment and get this scan done?
Well, we're saying patients between the ages of 55 and 80 who have a heavy history of smoking. What we're asking is that patients get a written order from their doctor.
Okay.
Once they have that order, they can easily schedule that exam through Trident centralized scheduling line, and that's 843-847-4986. And while this exam isn't covered by insurances currently right now, Trident wants this screening to be available to as many patients as possible to get the most benefit. So they've reduced the price to $149 out of pocket, and that's the lowest in the Low Country.
Yeah.
Trident's very dedicated to the fight against lung cancer and understands the potential that this screening actually has in saving hundreds of lives here locally. So we can't stress enough how important this screening actually is.
Absolutely, not a price to pay to save your life. It's $140 is pretty good. Well, gentlemen, thank you so much. Again, if you want to sign up, go talk to your doctor. We got all the information on your screen right there, and you can get that low-dose CT scan right here in the Low Country. Just call that number on your screen or visit the website right there. Gentlemen, thank you so much for all you do. We really do appreciate it.
Thanks for having us.
Keep up the good work. All right, more Low Country Live after the break. Make sure you stay with us.